It's my great pleasure to introduce dietitian Jennifer Wooley from Cardinal Health, who's going to talk about the trend to blenderized tube feeding, and is blenderized tube feeding right for you? I'll hand it over to you, Jen.
Thank you so much, Tracy. What a pleasure to be here with you. Being part of the Oley Foundation has been a game changer for me as a dietitian, and I've been a dietitian for over 30 years. The first part of my career was spent in the surgical ICU, providing enteral and parenteral nutrition to critically ill patients. And I was really in love with the control and the precision I had with prescribing down to the calorie or the milliequivalent nutrition therapy for patients. But in the later part of my career, working with the Oley Foundation, working with Cardinal Health, I've had a huge aha moment in the idea that precision nutrition means a whole different thing to enteral and parenteral nutrition consumers. It's not about controlling down to the milli equivalent. It's about controlling the quality of life and giving consumers their voice and partnering with consumers for the best outcomes. And it happens to be around a topic I'm very passionate today to share with you, and that is blenderized tube feeding. I want to make the disclaimer that the content I'm presenting today is the subject matter of clinical literature review and my subject matter expertise, and it does not constitute professional advice or services. The goals that I want to accomplish in this 45 minutes that we have together are to really just outline what's behind the trend to blend in terms of clinical benefits of blenderized tube feeding and some considerations or concerns that need to be thought through as you decide whether blenderized tube feeding is right for you. And in that informed decision making, we're going to talk about methods of administration, bolus, gravity, and continuous administration of blenderized tube feeding, and things to think through as you decide if blenderized tube feeding is a choice you'd like to make. But as you've been hearing all day, it's critical that healthcare professionals and enteral and parenteral nutrition consumers collaborate and listen to one another in order to have the best outcomes. Yes, the trend to blend is on the rise for both adults and pediatrics. A recent study that I looked at in adults reported that 55% of adult home enteral nutrition patients are using blenderized tube feeding in some shape or form, whether it's one partial part of their day that they're using it, whether they're using a home-prepared blend or a commercial blend. It is very much popular at 55% of adults on home tube feeding interested in blenderized tube feeding. And it's true for pediatrics. To quote a study from our very own Cynthia Reddick, who will be speaking next, she found that of all of the patients on home enteral nutrition at home, 61% of them are less than 18 years of age. So this is a huge interest level for pediatric patients of all ages. But let's be clear about our definitions so that we're all on the same page. When we talk about prepared blenderized tube feeding, we're talking about individualized, prescribed, blended, whole or pureed foods on a case-by-case individualized basis, whether that's in the home or the hospital setting. Whereas commercial blenderized tube feeding is blended, pureed whole foods that are prepackaged at a manufactured level. So they have longer shelf life, they have longer hang time, and they're less individualized than a home prepared blend. And then third, we have thick formula. Thick formula does include both prepared and commercial blenderized tube feeding, but it also includes standard enteral formulas that have been modulated with additives like fiber or extra protein or human breast milk fortifier. Those types of additives can influence viscosity. So blenderized tube feeding can include what we would call thick formulas as well. In looking through and thinking about the choices behind blenderized tube feeding, it's something that you'll want to consider for yourself. And the two major categories that I want to explore briefly are lifestyle and health improvement. There are huge amounts of data coming out looking at the clinical benefits of blenderized tube feeding in a host of patient populations. But in general, it's of interest because consumers, we all want to be healthy. We all want to improve our lifestyle and the foods that we're consuming. And there's a demand coming from enteral nutrition consumers for a more wholesome diet, whether they're getting liquid through a tube or eating it, instead of processed synthetic nutrients. So a more natural and wholesome approach to enteral nutrition. And being more inclusive with patients being around family members and friends, as Vincent was saying. When he enters in a social situation of a mealtime, he understands he's not necessarily going to eat. But with home enteral nutrition consumers, wouldn't it be nice if they could participate in the same meal with all the same smells that other family members who eat by mouth are having? So family mealtime and quality of life are behind some of the interest in choosing blenderized tube feeding, as well as the fact that there are a host of cultural and traditional reasons why we choose the foods we do. And synthetic commercialized formulas don't necessarily account for some of those choices. So being able to tailor a tube feeding to some of those cultural influences or lifestyle influences, whether it's vegetarianism or a kosher diet, is a nice option to have. The health improvements are amazing. They are growing as we study more the impact of whole foods blended to a consistency have on the body. Patients and consumers who haven't tolerated standard formulas now have a new list of options to explore. Those with an extended number of food allergies or food intolerances now have options to customize their feeding to their own individual needs. In the complex GI disorder patient population, living with GI symptoms is problematic and can undermine nutrition status. So it's been shown in several studies that blenderized tube feeding can decrease GI symptoms, minimize gastroesophageal reflux, and even decrease the amount and even the necessity for GI medications. But I think if we're thinking about outcomes and quality of life, it's really something that I'm astounded to see the research showing that a blenderized diet in pediatric GI patients has been shown to decrease the number of emergency room visits that they have, to keep them out of the hospital, and lower their healthcare utilization. And that can really be empowering. What are the concerns as you're thinking through, is blenderized tube feeding a good choice for me? Well, depending on the age of the consumer, blenderized tube feeding may not be the right choice for infants less than 6 months of age, or for both pediatric and adult patients who are severely immunocompromised. Because when you think about home blended formulas, those have to be treated like you would treat any food item with safe food handling practices, and not letting foods out for longer than we should without refrigerating them and that type of thing. So severely immunocompromised patients may have a tough time with keeping out of infection risk using home blended tube feeding formulas. However, commercial blends might still be an option to explore with their healthcare provider. The type of enteral access that you have is also another important thing to consider when you're choosing options for blenderized tube feeding. The smaller the French size of your nasoenteric tube, the harder it will be to administer viscous blenderized tube feeding formulas. If you or a family member has had a gastrostomy tube placed, that tract needs to be mature before you start with a blenderized tube feeding regimen. And just knowing what you're putting in your body, you would avoid blends that have any foods you're allergic to, and practice good food safe handling practices. And think about viscosity. The thicker that formula is, the slower it might infuse through your feeding tube, as well as the longer it may take with a pump if it's not a new generation pump. So understanding viscosity is very important, and we'll be talking about that later. And if you are embarking on a transition to a blenderized tube feeding, taking some time and adding one new food item at a time may help you understand any symptoms that you may be having. For those of you who are on parenteral nutrition, you may be wondering, is this relevant to me? And so I looked at a couple of studies, and I found that in infants and children, a recent retrospective case series was published just this year looking at intestinal failure children from the ages of 2 to 10. It was a small study, but they found that even if the patient wasn't able to get permanently off their parenteral nutrition, blenderized tube feeding offered a lot of value in terms of tolerance and quality of life. In this small study, 25% of the patients were able to wean off of parenteral nutrition, and the other patients were able to decrease their reliance on sole parenteral nutrition support without any negative consequences in terms of weight loss or GI symptoms. For adults living on parenteral nutrition, lack of using the gut can lead to a condition where the microbiota becomes compromised. That's called dysbiosis. And if research is showing that if we can deliver even a small amount of blenderized tube feeding, whole foods blended to a smooth consistency, that can help to replenish some of the healthy bacteria that live in the GI tract. So setting yourself up for success with blenderized tube feeding, if it's a choice that you're entertaining, is to know your tube and look at what size is your nasoenteric tube in terms of French size. The larger, the better. And according to the blenderized tube feeding recommendations that Lisa Epp and her group, Lisa spoke earlier today, published last year in Aspen's journal, 14 French or larger is recommended. There's been success with 10 French tubes. And with the new generation feeding pumps that we have here, the Kangaroo Omni, we have validation testing with success of having plus or minus 10% administration accuracy of delivery all the way down to an 8 French. So that offers some more flexibility for patients and families who use smaller French-sized nasoenteric tubes. But knowing your tube is key. And if you have a gastrostomy, making sure that it's been placed and has had time to mature is also important. And empowering yourself with knowledge. You and your A-team or your pit crew really need to have knowledge that sets you up for success. Understanding the impact of viscosity, having good food safety handling practices, and minimizing the risk of clogging your tube by flushing often and looking and inspecting the consistency of that feeding can help with decreasing the risk for tube blockage. These are tactics that can be taken into consideration as part of your arsenal to keep that tube functional. Again, knowing the tube type that you have and how it was placed and where it starts and where it ends and what you need to do to take care of it, looking at viscosity and blending practices, thinking about the consistency and avoiding lumps and chunks and seeds that aren't blended properly. And then preparing and storing things in a fashion that keeps bacterial contamination at bay, and always having a good flushing program. And then following your medication administration procedures so that medication is not part of the problem, increasing risk for your tube to clog. Moving into our second goal in talking about how to administer blenderized tube feeding, there are 3 main methods of administration. We have bolus, gravity or intermittent, and continuous. And it's definitely in your best interest to administer blenderized tube feeding into the stomach if you have gastric access. And that's because it has the chance to mimic normal ingestion and digestion and reach post-absorption and post-digestion if you have small, frequent meals with gaps in between them. That's the beauty of a bolus or an intermittent feeding administration regimen, is to have smaller, more frequent meals, allowing for complete digestion, absorption to take place in between feedings. With bolus, you have the ability, depending on the size of the syringe and the size of the tube, to administer the entire volume in a very short period and have flexibility to go all the way up to IDSI-4. What does IDSI-4 mean? We'll talk about how the IDSI levels of viscosity can help you with evaluating the safety of a certain viscosity in the formula that you're using. Whereas with intermittent, the thicker the formula, the longer it's going to take for gravity to administer it. So often, for those who prefer to use a gravity system, the IDSI levels 1 and 2 are more often chose with that method in order to avoid delaying the infusion time. And then with continuous, having a pump, you really have the luxury of being able to do intermittent or continuous feeds. And that offers a lot of options. But up until the new generation enteral feeding pumps entered the market in the last couple of years, standard enteral pumps were all that was available. And the literature and the recommendations are based on these standard pumps that weren't designed for thick formulas. And so the guidance is to limit the viscosity to IDSIs 0 and 1 with thick formula. But we know now with new generation pumps that you can push that and have accuracy and success as high as an IDSI level 4. So kind of looking at the advantages and disadvantages of each of these three methods of administration, I'm just going to pick a couple of highlights. These slides will be available to you and you can digest these lists on your own later. But just to highlight a few things with bolus, as I mentioned, bolus administration is more physiologic, it's quick, and it allows a lot of autonomy to do other activities throughout the day. But the thicker the blenderized tube feeding is, the more force it will take to be administered. And that takes sometimes a toll on the care provider to do all of that pushing with a syringe, and it can be difficult at times. It's just one thing to think through as you're making these choices. The next method, intermittent or gravity, again is physiologic because it's being administered into the stomach, and it happens where you've got digestion and post-digestion, which is more physiologic and beneficial. It helps with quality of life in that regard. But sometimes the thicker the blenderized tube feeding formula is, the longer it will take for that gravity administration, which has to be factored in with the other things that you're trying to do throughout your day or night. The biggest disadvantage would be that it can take longer to administer a more viscous blenderized tube feeding than you might like. With continuous enteral feeding pump administration, we have a lot of options here. We can do intermittent, we can do cyclic, we can do continuous 24 hours per day. And this offers patients who just can't tolerate bolus or gravity a really nice way to be able to use blenderized tube feeding. And they don't have the risks of aspiration or reflux. There are just some patients who require small bowel feedings, and a pump is a really great way to be able to administer blenderized tube feeding in those scenarios. The only disadvantage really is that you need more equipment, and it does take more effort to program the pump and get it up and working. But many pumps, the new generation pumps, are highly intuitive and easy to use. So it gives you greatest flexibility all the way up to an IDSI-4. And shortly here, we'll talk about the IDSI framework and how viscosity levels can be determined. It's important that we're talking about methods of administration because I want to quote another finding from Cynthia Reddick's work. In looking at the diverse population of patients that she cared for, 60% of home enteral nutrition patients were on commercial blenderized tube feeding. That's a lot of patients, whereas only 33% of her patient population was choosing bolus and 7% are using gravity. So the demand for the ability to administer thick formula when you're using a pump is certainly there. And it's worth talking about and worth considering if that's something that's relevant to you. But we have to be informed in facing some of the challenges that you can face when you're using a standard enteral feeding pump to administer blenderized tube feeding. Viscosity comes up if you're not aware of how viscous the formula is and you're not flushing as often as necessary. That can lead to the increased risk of your feeding tube clogging. The ability of the pump to administer a viscous formula is sometimes inhibited by the type of motor in the enteral feeding pump. And this can end up leading to under-delivery of thick formulas in standard enteral feeding pumps. And that creates the need for clinical oversight and maybe even some workarounds to combat those challenges, which we'll talk about. But in order to set yourself up for success, you really need to be empowered to ask questions and go to your healthcare provider and say, hey, I have questions, I need support. What can we do differently? So I encourage you to reach out for support. So now we're going to dive into viscosity a little bit further and really understand how the IDSI framework can be used to quantify viscosity before you use a blenderized tube feeding. Calories and water content are not the only drivers of the viscosity of a blenderized tube feeding. Other factors to think about are the type of blender that was used, the method of preparation for the blenderized tube feeding. What is the hydration content of individual ingredients used in the blenderized tube feeding recipe? What's the temperature of the formula? When blenderized tube feeding is made in batches and it's taken out of the refrigerator to be administered into the pump or the bolus, a cold blenderized tube feeding formula is a lot more viscous than if you let it warm up slightly to closer to room temperature. So temperature will affect viscosity. Seasonal variation in ingredients will affect viscosity, as well as the environmental temperature. So really want to just drive home that there are a number of factors to consider, including the shelf life date on your commercial blenderized tube feeding. The longer they sit on the shelf, the more natural evaporation of water can happen. So a formula that you thought was maybe an IDSI 2 when you first purchased that commercial blend, sitting on a shelf for a period of time could make it change to a higher viscosity because of that manufacturing date. So this is the IDSI framework that you're seeing, and it stands for the International Dysphagia Diet Standardization Initiative. And it was designed for patients who maybe had a neurological event and have swallowing dysfunction called dysphagia, in order to standardize and make the criteria for different types of textures easier for consumers. And it's applicable to tube feeding as well, because if you look at the drinks here, IDSI level 0, 1, 2, 3, and 4 are drinks, and IDSI level 0 is a thin liquid, increasing in thickness all the way up to extremely thick. So new generation enteral feeding pumps like the Kangaroo Omni are able to administer all the way up to IDSI 4 with plus or minus 10% accuracy of delivery, which gives you a lot of options, and accuracy is key. And this is the test that you can do right at the point of care in order to check the IDSI level. You can get an IDSI funnel from the IDSI website, or you can use a 10 ml syringe and take the plunger out and put a defined amount of formula, up to 10 mLs, into the syringe. And then when you put it in, your thumb or finger is at the bottom of the syringe, and then you remove your thumb and get your stopwatch and watch it for 10 seconds, and then put your thumb back over the opening, and however much volume is left in the syringe at the number will tell you your viscosity level. For IDSI levels 3 and 4, the syringe method won't necessarily work, so you have the fork test or the spoon tilt test. And IDSI levels 3 and 4, if you look at this fork here in the top picture, it doesn't necessarily fall through the prongs of the fork very fast. So that would be about an IDSI 3. And then if it stays right on the top of the fork, it's an IDSI 4. Or if you have the spoon tilt test, it doesn't come off the spoon. That would be indicative of an IDSI 4. So these are easy, reliable, objective tests to look at the viscosity of a blend. And we want to empower you with tools and resources because we want to take the workarounds and the guesswork out of blenderized tube feeding. If you're someone that needs a pump for your feeding, standard enteral feeding pumps have had some challenges. One of the biggest problems is receiving the total blenderized tube feeding volume in the desired time frame. The clinical workaround has been to lengthen the time frame of the feeding in order to get the prescribed volume in, which can inhibit quality of life. Or if the blend is too viscous, diluting it out with some fluid in order to bring it down to a viscosity that flows through the tubing more efficiently. And with GI complex disorders, there's something about the viscosity itself that's so beneficial to GI symptoms. So that could be counterproductive. We don't want to have to lengthen the time of the feeding or dilute out the thick formula in order to accomplish the feeding. Another problem is about accuracy. There was a head-to-head study looking at 3 of the main manufacturers, and they found that with that error rate, a 22.5% error rate can really put a patient with malnutrition risk in jeopardy. So accuracy is really important. The new generation feeding pumps, the Omni that's here today, can administer all the way up to IDSI 4 with plus or minus 10% accuracy, both commercial and prepared blenderized tube feeding. And that certainly is superior to some of the standard pumps that have an accuracy delivery range of 14 to 30%. And if you look at it, this new generation technology gives you options to do automated feed flush, and it's color-coded to know which feeding set is doing what. Blue implies feed and flush, green is for thick formula. So it's a very intuitive way to know that you have options when you want to use a pump to administer thick formula. And these new generation pumps take into consideration things that are important to you, like portability and being able to use a backpack instead of an IV pole and be able to have a longer battery life. These are all advantages that have been incorporated into new technology. And in closing, I just want to emphasize what we've been hearing all day, and that is the critical need for collaboration between healthcare professionals and enteral and parenteral consumers. Clinicians haven't had the training necessarily to feel comfortable with blenderized tube feeding, and we're providing that now. Home enteral nutrition consumers have been seeking guidance from the internet. We don't want you to have to rely on that. We want you to have a team, an A-team to go to. And as Teresa Fessler said in a Lifeline newsletter from 2019, it's up to the EN consumer and his or her medical care team to decide what is best. So in summary, I just want to empower you to look at the choice of blenderized tube feeding and see if it's right for you, and partner with your healthcare team because together I'm sure you can accomplish your goals. Thank you for having Cardinal Health here today. And we have our Omni pump set up at the back there where Nithika Badam is if you'd like to come and see a demo or ask us any questions. And if you have any questions now, I'd be happy to take them. Thank you.
I can pass around the mic if anybody has questions. Thank you, Jen.
This is our QR code for the Kangaroo Learning Center. If you want to take a picture of that, we have a lot of patient and family-centered resources, including demos that you can see around our technology in order to help you with your decision making.
We have a question over here. Anybody have a question? Raise your hand. Right. Vanessa.
I have a J tube and my tolerance has been very low, so I'm at a very low rate, like continuous 24/7. And I have the older version of the Kangaroo pump. Could Blenderized feeds maybe help me to be able to get the tube, like get the feed rate up higher so the malnutrition and everything doesn't come into play? Have you seen like any results of people being able to tolerate a higher level with a Blenderized as...
I think that it has to be considered within the context of why you're on a jejunal feeding and also the viscosity of the blend that's being administered. Okay. The commercial Blenderized formulas have had a great amount of success with jejunostomy feedings, and that could be a starting point. And then once you build confidence and experience, you could then, with your healthcare team, experiment home prepared.
Okay, thank you.
Thank you so much. Another question? Any questions? Well, thank you, Jen. Thank you, Cardinal Health. If you would like to check out the Omni Pump, it will be in the back of the room, like Jen said. Thank you so much. We'll get ready for our next speaker.